All right, welcome everybody to today's Feed Your Mind, Understanding Addiction, Recognizing Signs and Symptoms. My name is Wendy Singer, and I am the executive director for an awesome nonprofit called No Shame on You. We are dedicated to eliminating stigmas associated with mental health conditions so people who need the help will seek it and family and friends will know how to support their loved ones and ultimately to save lives. We achieve our mission through community outreach programs, workshops, an online presence of 120, over 120,000 social media followers on LinkedIn, Facebook, and Instagram. We have a blog, podcasts, distribution of resource guides and other resources, videos and educational presentations we do for all audiences of all sizes. We partner with organizations throughout the Chicagoland community and country, and we are known for our inclusive, consistent, and responsive programming for people of all ages and backgrounds. Today, I'm really excited to have a wonderful person, Andrew Rintels, who has been a supporter of No Shame on You for a long time. And before I introduce him, I just wanted to do a little housekeeping. Following the presentation, we will have a time for a Q&A, but you can ask a question at any time during the presentation. Andrew is open to that. So if you do have a question, you can submit them to me at Wendy, and I'm listed on Wendy, No Shame on You, listed on your page. Send them to me directly. If you accidentally send them to the whole group chat, no big deal. We'll get it out. So now I'd like to introduce Andrew Rintels, who's a certified Love First clinical interventionist and psychotherapist. He specializes in assisting individuals grappling with addiction and offering support to families as they navigate their journey to recovery. His background includes working with various healthcare settings, including medical detox, residential care, partial hospitalization programs, and intensive outpatient care. And he now runs his own practice in the Chicagoland area, AR Intervention. Welcome, Andrew. We are so happy to have you.
Thank you. That was very nice.
And Andrew is a really fun, down-to-earth guy. So I hope you will enjoy this presentation.
Thank you. I'm going to put up my quick slide here and share. And then I'm used to talking to people in person. So if you guys want to, if you have a question, if you want to throw out an emoji, if you want to do a clap, you want to do, any sort of emoji is fine by me. Just so I know that you're there. It's a little alien to me to not be in front of people. But I'm open to questions. It's a really, really difficult situation, learning about addiction because it's so vast. And with any other, chronic illness, likely your neighbor will bring you over a casserole when when somebody's son says, oh, they're an alcoholic. No one's bringing you a casserole. In fact, they're hiding their children. So, yeah, I really wanted to know more about addiction. I'm pretty open about my own past and my own familiarity with addiction as well as recovery, mainly because of Google. People can find out anything if they look. So pretty open about kind of how I got to where I am and learning about all this. One of the first things was growing up in the northern suburbs. There really wasn't that much talk about what addiction is, right? In my house, that wasn't something that we talked about, and it certainly wasn't something within the Jewish community I felt comfortable talking with anybody about. And so I wanted to learn more and more, and then I started asking questions and wrote a couple papers and got some letters after my name, and I just kept on searching more and more to better understand addiction. Again, if anything doesn't make sense, I tried to kind of outline it best I could without a laser pointer. I'll do my best. But first, I just want to kind of introduce myself. And again, if there are questions, please throw it in the chat or let Wendy know. Impact, symptoms, treatment, recovery, etc. The first thing, oops, is I wanted to do is, talk about what is addiction, what isn't addiction, right? I think it gets thrown around a lot by people saying, "Oh, I'm so OCD," and "Oh, I'm so addicted to this and addicted to that," and it can be talked about in a hyperbolic way. Condition that's progressive and fatal if left untreated, but it is manageable, right? Um, so, basically, when you're looking at the brain, and I am not a doctor, however, through my studies, on brain scans and so forth, there are, many, many brain circuits, which can misfire, right, at any given time. Of course, your genetics and your environment also can be difficult, as well as your life experiences. If it was a matter of willpower, I hear people say, if so and so loved me, they wouldn't do this. Well, it's not that easy. It's not just lack of willpower, as people sometimes think it is. Um, Different types of addiction. The main two that are typically talked about are substances, continued use despite consequences, um, and then now more recently, the behavioral, becoming more and more um, familiar with identifying, the similarities with addiction, which is an emotional anesthetic, something you can do to disassociate yourself from what it is you're feeling. You feel a certain way, you want to do something else to feel different. Um, and that goes with gambling, shopping, internet, gaming, food, sexual health. All these things can be a distraction from the way you're feeling. And then it gets, kind of a blueprint. When I was growing up in high school, things would arise, and I knew that my friends, were doing certain stuff on the weekends, and I knew it would make me feel different. Yes, I'll share them, Cindy. I knew that doing substances would make me feel different, so I did that, and it just became a blueprint. Whenever I was feeling something I didn't want to feel, um, that I knew that there were substances available. And I didn't know why, but I knew it worked until it didn't. Yeah, I worked in finance for about a decade, and I enjoyed it tremendously. But again, I started seeing these patterns of behavior in myself that I didn't understand. Um, and it's awfully difficult to try to fix an airplane when in flight. So I was able to kind of take a time out and look at where I am and look at where I want to be and how do I get there. Um, as I mentioned, it's not a choice. Um, it's a way of living. It's a way to stay alive, really. It's a way to self-medicate with, because if someone's feeling anxious or depressed, they know they can use drink, marijuana, cannabis to feel different, and it'll help them emotionally, feel a little bit better. It is chronic, it will not just go away. Um, much like a carcinoma or some sort of mole on your back. You can't pray it away. You have to have some sort of treatment plan and follow through with treatment recommendations for best chances for success. Um, and one of the hardest things for me included was the stigma of, not my son, uh, and this overarching feeling of shame, until I met Brene Brown, and she, you know, uh, educated me that, guilt is you did something bad, shame is you are bad. And I think that shame is kind of one of the things that really keeps a lot of people really, really stuck, because they're not able to talk to anybody, fearing that they're different, and sometimes we make very uh, irrational choices. Um, uh, uh, um, Prefrontal cortex is where all the planning in the brain goes. And when you start using substances, you have a lot more problems with solving problems, with weighing risk versus reward, right? You might see people who are a little bit more lazy, who make bad decisions, who, whether it be with finances or romances, maybe a little bit more impulsive. Um, a lot of times you think, okay, what is addiction? And we can open up the DSM and look to see what that looks like, or we can just, there online there are several uh self-assessment tests you take to just find out, hey, am I? You know, I can tell you that, through the people I've worked with in different levels of care, If somebody never thought they had a problem with shopping, they probably didn't. If someone thought that they might have had a problem with shopping, there's probably something there, right? And it's the same thing with, any addiction, right? No one that doesn't have a problem with alcohol thinks, I wonder if I have a problem, or doesn't drink the entire month of January to prove they don't have a problem, right? It's not about, necessarily, uh, you know, stopping for the week. It's what happens when you use. Is there an off switch, right? And a lot of times, the misconception is that people can just um, do it on the weekends, and but if they're blacking out and they're having more and more uh negative consequences, it's really time to look at, okay, what is this substance, alcohol or whichever, what is it doing for you versus what is it taking away from you, and is it serving you, and can we am I making excuses for the way things are, or do I want to be the person I'm supposed to be, right? And that's really something which, when I work with people, I try to ask them is, kind of, where are you and where do you want to be? And is this helping you get there? Right. And a lot of times all these things can kind of get in the way. Um, Growing up in a family, where your parent, people say, oh, his father has addiction, therefore he is. Maybe, you know, when you look at your parents and you see a maladaptive way of doing things, maybe you see not talking about things and just having a drink and just forgetting about it for the night. Maybe that's not, the best way about going about things for healthy relationships and communication down the line. There is a genetic predisposition. There's also, you know, uh, uh, generational trauma, and dealing with, whether it be indigenous people or people from World War II, when things happen and people just clam up and don't talk about things, it's a way of dealing or not dealing with things that are difficult. And those things can follow us and really haunt us later in life unless we actually talk about it and work through it, opposed to just ignoring it. So the genetic predisposition does matter, but also the environment, right? If you grow up in a place where, you know, uh, maybe you have a parent who's a little bit more anxious, you might try to control things. We don't grow up in a vacuum. We are the way we are, um, because of or despite who our parents are, from your hairline to your jawline to your height or lack thereof. We are who we are because of our parents. And with that stress in the house, with possibly some trauma, and that's a very um, broad subject, but trauma is also really, really important, as people use substances oftentimes as a coping skill, right? And then the availability, if alcohol is flowing freely, or if now if parents have cannabis in the house, well, they don't really kids don't see it's really a problem because their parents use it. And whether it's a problem or not, there's a reason why the age to rent a car is 25, because your brain's still developing, right? And while some people might be able to use cannabis without problem, if your mind is still maturing, then it's really putting yourself at a disadvantage by putting those substances in your body. I understand that mom or dad might do it, or older sibling, or so forth. Um, but there is this idea that you might have an allergy. Allergy is defined as a unusual reaction to a usual substance. Some people might have shrimp, well, maybe not shrimp, nuts, right? So you might have nuts, and I can eat nuts all day and I'm fine. Some people might have start to eat a peanut and it'll start to get a little tingly. They have an unusual reaction to a usual substance. They wouldn't wait 6 months and say, you know what, maybe I'm going to try peanuts again, because that's crazy, right? But with alcohol or other substances, some people can use cannabis to relax one night, but other times people who are using it daily, right? It becomes more than just uh, uh, more than just a habit. It becomes a necessity, right? So and again, it causes an unusual reaction to crave more, right? And the more you understand addiction, kind of what it's doing, um, the better, the earlier and the better, it can be. At first, there are different stages of addiction. Um, you know, which I'll get into in a second. But first, we start using substances, and this seems to work. Um, oh wow, I really like it. I'm really kind of getting social currency. It's still working for me, and people build up a tolerance. You'll see people drinking, more and more, using more and more whatever the substance is, and then there's a dependence that happens, not out of desire, but because that's what happens. It's because of science, right? It's just, you know, you come to not be able to function without that, right? And that's where, the addiction can really come from. The problem is that, the addiction, once that starts to happen, has quite an effect on our body, right? Physically, things can start to get, very challenging, can look very, very different for other people. And of course, the mental health piece, um, you know, uh, you know, it's ironic that people have anxiety, right? And then they want to use substances, and they say, "Oh, well, I do it because I'm anxious." And then I like to ask, "Well, is it making you less anxious?" And they say, "Well, no." Okay, well, maybe it's not working as you'd hope it will then, right? So, and also, when you have anxiety and you were to, use alcohol, it's a little bit like holding a beach ball underwater, right? It might work for a minute, right? But as soon as you let go, the beach ball jumps out of the water again. That's exactly what your anxiety does. So then you want to have another drink to keep it pushing it down, right? And then you see a lot of people who are depressed who like to drink. And again, because of this, science, it doesn't make sense if you're depressed to put a depressant in your body, right? But we do again and again and again, right? One of the hardest things is, the isolation that, we prefer to be by ourselves. And oftentimes things start out in a very social manner, and they end up not wanting to be judged by their family, not wanting to be judged by their friends. Um, the alcohol does take away some of your anxiety, it does take away some of your pain, but it also takes away your joy, and it also takes away your family, and it also takes away things that really matter to you, right? So, yes, it does a good job of taking things away, but I've seen people, truly get their lives back in a new way. Once you get on the other side of addiction, um, physically, of course, with alcohol, there's the liver. Um, and when someone comes in looking like Homer Simpson, not just the belly, but the color of his skin or her skin, it's quite frightening to see someone so yellow and jaundice, right? That means their liver's, shutting down. Um, and then of course cardiovascular disease, um, and the fact that you just are, even though people can run a marathon and they say, "Oh, I'm in good shape," you can still continue to drink like that, and it will have a um, a lethal effect on you as time goes on. It's just, matter of when, because, as we get older, our metabolism changes. Somebody who's used to having the two martini lunch, as they get older, they don't, it maybe doesn't work with certain medications. Maybe your metabolism changes. Maybe, all sorts of things start to deteriorate within the body. And we're not here for long enough as it is. Opioids are all over the news, wherever they come from, whether it be legal or illegal. There is the risk of overdose. It's crazy to me to think that you can put something in your body and and it might make you feel good, or it might kill you. It's really, really scary, especially um, for our kids, right? And I have three sons, and if they're anything like I was, they're going to need some education around that. Um, but when you start taking opioids, it does, again, takes away your pain, but it once you have a tolerance, it becomes pretty difficult. Unfortunately or unfortunately, when detoxing from many substances, it's not life threatening except alcohol and benzodiazepines. Anything else, you might feel like you want to die with opiates, but you're not going to. But there are comfort meds or withdrawal management things you can do to make you feel a little bit better, um, to then start working on what the problems are. Or smoking. Why do people smoke? You know, there's a lot of studies as to, it is social, but at the same time, it becomes habitual. And eventually, we end up being by ourselves, and our health can significantly be negatively affected. Behaviorally, our sleep oftentimes will get messed up. I hear people say that they're having trouble sleeping and they can't sleep without this, or they're napping all day, or they're sleeping till noon, and oftentimes their sleep cycle is certainly out of whack. And some of the behaviors might be nonsensical as to why someone needs to go outside in Chicago, and when the weather is 10 degrees, to go outside to have a cigarette. It seems crazy to go outside and suffer outside for 10 minutes, to come in and smell bad. Yet many people did smoke because they didn't really realize the implications it could have later in life. And I'm not shaming anybody, as a former nicotine user, I fully understand it can be, actually, nicotine, I think, is the hardest thing to rid yourself of.
Andrew, we do have
Yes.
a quick question that came into me. Because substances have more, clear um, physical symptoms, is it less prevalent than other addictions like gambling, where there might not be a physical symptom?
Is it less prevalent? Well, the thing is about gambling is that, and one of the hardest things is that, what was once the people who were habitually gambling are now further down that chain. People who are recreationally are now, further. It's the same thing with cannabis, right? People are using cannabis in, who wouldn't necessarily do it, but now it's become social because it's legal. Just because it's legal doesn't mean that, I should be putting it in my body. Um, Gambling is one of those things where the suicide rate is very, very high because people don't have money for, there's a shame. They don't have the money for treatment, right? A lot of times they put their families at risk, and people are more likely to attempt and die by suicide. With other addictions, people, oftentimes will minimize it because it's not, gambling can be black and white, or in the red. Whereas substances, you could see somebody who is having issues, and you can see them shaking. You can see them, physically having more consequences. So, will gambling have become more prevalent as far as treatment? Absolutely. And there are things like TMS, or transcranial magnetic stimulation, which can really help a lot of these addictions, which we can't see. But the substances or the behaviors themselves aren't the problem. It's fun for me when I'm talking to somebody who says, "Hey, I want to stop drinking," and I tell them that, alcohol's not your problem. And they look at me rather slack-jawed and they say, "What do you mean?" And I say, "Well, it's a solution, right? It's a maladaptive coping skill that you've learned, can help soothe you. But, if you're not drinking, right, then okay, what do you what are the problems, right? And maybe it's inability with financial stress, maybe it's inability to communicate, maybe it's inability to family, isolation. So there's all these reasons why we use whatever the addiction is. Once we put those aside, and that's where residential treatment can help by taking you away from these things. Then you look at, okay, what are the things that are popping up, right? Are you being anxious? Are you, what is really going on with you? What does your baseline look like without being able to be on your phone, being able to be on social media, right? Um, so did that partially answer the question? Hopefully,
I think so. Thank you,
maybe.
Andrew.
If not, part two, it's coming. Um, so, a lot of times when we're talking about these addictions, they're covering up other things, right? Like I talked about, the anxiety and the depression are obvious. PTSD, people are having, difficulty, if they, served our country, coming back, having dreams or nightmares or trauma. Um, there are many reasons why we can, be having post-traumatic stress. And addiction just kind of makes those things worse, right? Because it doesn't really cure you. All it does is, push that beach ball into the water and kicks the can further down the line, and your inability to really live life in a manner which you want to be living it. Um, Oftentimes people talk about, you hear about co-occurring or dual diagnosis. I've never seen anybody with a substance use disorder not have anxiety, depression, something else going on. So the idea that now facilities are saying, we're co-occurring, that's terrific. Dual diagnosis is kind of limiting, right? I mean, if you have anxiety, depression, and substance use disorder, I want to make sure there's room for that. So, I think the term co-occurring probably makes more sense. But oftentimes there are other things that are going on, which is why psychoeducation about what is going on, what is happening to your brain, why it's happening to your brain, um, homework, even though it might seem silly to talk about what it is you're feeling, and to be able to figure out, okay, what is really going on. Um, you know, I know a little bit about a lot and a lot about very little. When it came to homeschooling my child, even though I enjoy my family, I didn't go to teacher school. So I'm not a person who should be teaching my children. Plus, there's a daddy death thing, right? So, you know, um, there are people who, if somebody is a professional in a certain area, um, I like to really, talk to them about stuff, right? So likewise, if I'm having, struggling with some things regarding anxiety, I like to talk to people who have studied it. Or addiction, I think it's important to talk to people that have studied it, maybe even lived through it, to be able to tell you, hey, what's worked for them? And more often than not, they'll tell you that isolation is, probably one of the hardest things you can do, and the opposite of addiction. That's Johan Hari, and I have many, many TED Talks I can, forward on, but Johan Hari talked about how the opposite of addiction is connection, right? When we think about the harshest penalty we can give somebody when they're, incarcerated, it's, being in a solitary confinement, right? Um, Not just Edgar Allan Poe, but people can, go crazy thinking about, um, you know, not being able to talk to anybody else, right? So, it's really important that, especially during COVID, a lot of it was a breeding ground for addiction because people didn't have to see anybody. You didn't have to shower. You didn't have to put on pants. There are a lot of things you didn't even have to do because you can be behind screens. And there's just something really powerful about just going and having coffee with somebody and just talking as, the spirit moves, you both, and just, being able to look at someone in the eye and saying, how are you? Opposed to saying, fine, or using um, acronyms like LOL. Um, uh, Fred Roizen talked about the 4 L's of addiction to identify it, because a lot of people say I can't be an alcoholic because, and that's the start of a long conversation. Not using medication. Yes, yes, it can be used without using medication.
There's a question in the chat. Yes. Can addiction be reversed without using medication?
It depends on what the addiction is. I mean, if there are withdrawal management or detox that needs to be, you know, uh, addressed, then, of course, you want to make sure that if somebody is drinking every day, if they don't safely detox, there's a risk of seizure or death. And, having worked with people and helping get people to treatment, I have no problem with them having a drink, because I'd much rather, 100 days out of 100, I'd rather someone have a drink with me than a seizure with me. I've been around both. I'll let you guess which one's more fun, but it's really important that somebody does, detox appropriately. Um, and then, once they're stabilized, you're looking at, medication. Well, let's see, are they anxious, right? If somebody is anxious, or they do have depression, right? It says in the DSM, or Diagnostic Test Manual, it'll say all the reasons and all the classifiers of of what you think that might be going on of the anxiety, right? But on the bottom of all of it, it'll say if it's not substance induced, right? So if you're using substances, then you really can't get a proper diagnosis of really what is going on if you don't have a proper baseline, you know. And then maybe medication could help, maybe it wouldn't help. It depends on the substance and depends on um, depends. A lot of people don't want to take medication, and I understand that, but there are other things that you need to be doing if you want to keep the addiction at bay. You know, so hopefully that answers the question a little bit. The four L's are oftentimes, I bring up because people say I can't have a problem because of this, and that. Um, are you having are you having any sort of negative ramifications to your livelihood? Right? Are you able to keep a job? Are you able, are you switching jobs a lot? Are you having financial issues, missing work? The cost of going to going elsewhere opposed to going to where you're supposed to your job and where you're supposed to be, right? Are you doing something meaningful, right? If you're, I see a lot of younger men, mostly who are, they talk about that failure to launch, but why would they want to leave home? They get their laundry done, they get food, it's very comfortable, but I wouldn't want to be a gnome in my mom's basement, but we're just afraid to go out and take chances, right? And again, COVID was very unkind, to say the least, to many people, right? But a lot of times we get stuck and we self-medicate with certain things to make so it's not so bad, right? Is it affecting your love or your relationships, right? Does your family not want you to come to certain things, or do they treat you different because of you know the plates you broke last Thanksgiving, right? They want to make sure that they can trust you, and a lot of times, we really stress our relationships when we're not our best selves. And a lot of times, family doesn't really know about addiction or how to best treat it, which is why, again, I think it's really important to talk to somebody who does understand addiction. You know, legally, I've heard people make excuses about, well, the officer pulled me over because I didn't have a tail light and it was silly and, I shouldn't have gotten that, DUI or, you know, um, but when somebody keeps, you know, saying something over and over and you keep getting 3, 4 DUIs, maybe it's not the other people's fault, right? Maybe there's something to that, right? If there are fights and so forth, a lot of times anger, with amongst in the family, spousal especially, can legally get involved when alcohol gets involved because all that does is really get a magnifying glass on the behaviors that are already going on, and that's where a lot of legal involvement also comes from domestic situations. Um, and then the fourth L is liver, right? Your health. How is it affecting your physical health, your mental health? Um, and people kind of get to start to see is, what, maybe alcohol isn't doing for me what I thought it was going to do for me, right? The thought of going to the Cubs game and having one beer sounds terrific, but I don't remember ever doing that. Right? One beer doesn't do much for me, you know. It's kind of like opening up a bag of M&Ms, having one and putting the rest in your pocket for the rest of the day without eating one. For me, it doesn't really make sense. So I try not to mess with M&Ms. Um, the symptoms, um, are pretty, typical. If you're procrastinating, you're no longer doing the things that you were supposed to be doing. Maybe you're not telling the truth. Um, you're a poor historian. Your behaviors are erratic, and oftentimes there's underlying mental health things that are going on, but we don't realize it, right? We think that we're fine. Um, and that isolation creeps in because then no one's going to comment on how much I'm drinking, how much I'm, doing this, that, or the other, because no one, I don't have to worry about the price. I don't have to worry about anything if I'm alone, right? Except for loneliness. Physically, a lot of times you can tell when people are changes. I know Matt Perry was just pretty vocal about his addiction and how he put on weight when he had been drinking and or using opiates and then when he was losing a lot of weight, he could tell from his performances as to kind of what was happening. So visually, you can tell that, someone isn't, maybe their legs are getting, they don't have ankles anymore because their ankles are so swollen, goes straight from the knee down to the foot. There are a lot of physical ailments that start to happen as we get older, um, physically, and of course, sweating, shaking. Um, yeah, many people have said, I've always had a shake in their hands. I'm like, well, no, you didn't always, from the age of like 6, right? It probably started, as we get older and we're kicking this can down the road. And psychologically, right? Most people, if they're being deprived of what it is they want, will be crabby, mood swings, paranoia, blaming others, and those cravings because they know it's going to make them feel better, you know, almost like, I don't remember if anybody remembers, Billy D. Williams. He used to do these commercials for Colt 45, works every time. It's true, right? When you had a Colt 45, you knew what it was gonna do every time. And, for me, to just have like that much vodka, I know what it's gonna do to me every time, right? Or that much vodka, I knew what it's gonna do to me every time, right? So we become, pretty well versed in what's gonna work for us because it is very, very dependable. And it's more and more common when we grow up around, in families where maybe our home life isn't so dependable, right? We don't know what we're gonna find. We don't know what kind of mood our parent sibling is gonna be in when we get home. We don't know what we're gonna have to, to do with, and we become a people pleaser because we don't want to make dad upset. We don't want to make mom angry. So therefore we are trying to be, perfect. And thought of perfection is adorable. Um, looking at treatment, once it's been, identified that you would benefit from, treatment, again, I think going to finding the right place. And again, there are, whether it be No Shame on You or other organizations or anybody who does, um, specialize, you can always get an assessment. You call up and say, hey, listen, I'm worried about this. Can you tell me, can I have a risk-free assessment, right? No obligation whatsoever. They'll call and assess you, right? If they think that, you've been using, and there are some detox, um, issues that might arise. I think they're starting to call it withdrawal management. Sounds a little bit better than detox, but it's to make sure that the substances safely get out of your system, right? And then, stabilize, from detox, which is probably, the highest level of care. Then, there'll be a residential treatment, your 28 or 30-day program. Um, after residential, there'll be a, like a step down. And sometimes, and it's not necessarily linear either, but this is kind of from most extreme to, less restrictive. Um, is PHP, or partial hospitalization. That'll be, from like 9 to 3, 6 hours, 5 days a week. And then after, uh, PHP, there's IOP, which is, 3, 4 hours, 4 days a week. So it kind of tapers down, and then OP, or outpatient, can be 1 or 2 nights a week. But a lot of times people will start an outpatient, right? And they'll see if they can stop using substances. And if they can, great. Maybe the education did it. Maybe they meet other people who are also struggling, or maybe they're unable to stop continuously, right? Stopping is easy. It's the staying stop is the tough part, you know. Um, I like therapy, personally as well as professionally. I think it can be really, really helpful to have, to talk about what it is that's going on, to have that validation, to be able to have that safe space, to be able to, normalize what it is that's going on, and maybe give us some insight into what's happening. Um, I've been driving my car for well over 30 years now, and I still have those mirrors on the side, uh, because I have blind spots, right? And a lot of times in life, we might not realize it, but we also have blind spots. And sometimes, counseling, whether it be group or individual, can be really, really helpful for us to, um, to be able to accept that we do have blind spots and that we do need other people to maybe kind of point some stuff out and call us on our stuff. Um, medication assisted treatment. There are various things you can utilize. There are some medications you can take when, to prevent, opiates from getting into your system, like naloxone, whether it be oral or injected or implanted. But again, the substances in and of themselves aren't the problem, right? So Matt's great, but there are it might not stop you from drinking, right? It might make you drink less. Um, and again, opinions vary on MAT. Listen, so maybe it's risk management, maybe, there are all sorts of reasons on a case by case basis. It makes sense. The key is to stop people from dying and be able to talk about what is going on, and be able to have them have a richer, more fulfilling life. Most times, Prohaska and Prohaska, they are related. Came up with the trans theoretical stages of change. A lot of times people would say to your son, well, I don't have a problem. So they're pre-contemplation. Then they could say, okay, well, maybe I do have a problem, but I'm not ready to do anything about it. They're in contemplation, right? Then preparation, action, maintenance, and relapse. A lot, and it's not cyclical. The idea of addiction treatment oftentimes isn't linear, right? But there are many stages and things to learn about it, which I'm not going to bore you with today. I'll wait till another day. Relapse prevention. It's important. Most people are going to have a lapse, right? If you were to have, God forbid, cancer, right, and you were to be in remission, that's wonderful. And if the cancer comes back, you wouldn't say, oh, well, I'm not going to get treatment again because, it didn't work the first time, right? You're going to say, okay, well, let's sometimes it's like whack-a-mole, right? And you have to then, figure out, okay, what can I do now? And a lot of times lapse does happen with chronic illnesses as like addiction as well as other ones. Um, and the key is to not get discouraged and to learn, okay, maybe what can I do differently? How can I, what did I miss? Um, I like having these learning experiences. We have a lot of those in my house. Because we're gonna make mistakes, right? The key is to make new mistakes and not make the same ones, right? Because make the same mistakes over and over, expect a different result. That's the definition of insanity, right? And avoiding those triggers as well. Um, there is a lot of family and community support. There are many resources that are available, which are just just getting in touch with the right people is often the hardest part. I love the fact that we're spreading the message of not having shame and erasing the stigma because a lot of us are struggling, and it's easy to look at to say to somebody, "Oh, look what they're going through," when we all have stuff going on, you know. Um, and there are some self-help strategies that do work, but again, to find those out, it's helpful to talk to a professional who can kind of help guide you through those things. Um, family therapy, family education. There are places locally as well as nationally, which I'll get to in just a sec, which can be really helpful in finding out more information about the family. Oftentimes, if someone goes away for treatment and they come home, it's a little like cleaning up New Orleans after Hurricane Katrina. You can clean it up all you want, but unless you fix the levee, you're going to flood again, right? And unless the family has some changes in their communication and their setting boundaries, um, and learning about addiction, their likelihood of a lapse is a lot higher. Boundaries are real important, and being supportive. Um, nationally, there's SAMHSA, the Substance Abuse Mental Health Service Administration, who has it's a wealth of knowledge, and they have many workbooks you can get through them. There are 12-step support groups, AA, NA, and many others. But those can be very helpful as well. The rehab centers, Hazel and Betty Ford is nationwide. Rosecrans, Banyan, Recovery Centers of America, Gateway, depending on, what's going on and the presentation, it's really important to get people to the right place for them. And those are some great places to start to at least get some information. Outpatient, there are more of, again, less restrictive. And if it's clinically appropriate, then, it makes sense as well. And then, a lot of times therapists, work virtually. So within an hour, if you have a phone or a computer, you can kind of get what you need, at least for the week. So in today's day and age with technology, we can get a lot of help without even, having to put shoes on. For self-help, mindfulness, yoga, healthy routines. If every Tuesday you're doing one thing, every Wednesday or Thursday you're doing another, people will start to hold you accountable, right? And start showing up. So if you're not, people are going to call you on it. So being able to have people who will, kind of hold you accountable. I can talk much more about all these things. The Addiction is a very, very broad topic. It's my understanding this is just 101. The advanced course, or with more, with a little bit more direction. I'm happy to provide a lot more information, and know that even though addiction is a chronic and progressive disease that is fatal if left untreated, it's manageable, you know, and you have a choice, while we might not have a choice of being afflicted with addiction, um, recovery is our responsibility, and what you do with that, you know, with great responsibility comes great, with great power, with great responsibility. It is our responsibility to continue to get well and to help others to do the same, because it can be really, really scary and overwhelming. I know it was when I didn't have anybody to turn to and I didn't know what to do. So, uh, my goal is to be an advocate. I work as a licensed social worker, who specializes in addiction, CIP. I'm also a certified intervention professional, helping people get the treatment that they need, not the best, but the best for them. Um, because it depends for everybody, contingent on a lot of factors, and so I try to give people, um, the doorways and the keys to things that'll make them better. Um, and I think I'm running out of time,
You did
but
perfect. Thank you so much, Andrew.
I appreciate it.
Um, we have a couple questions. First, there's a question in the chat, and the second one, someone wants to unmute and ask it. So we'll start with the question that was in the chat. Can you touch upon sexual addiction? How does that differ from alcohol and drug addiction?
I think sexual addiction has a negative connotation, right? Oh, I try to use the term, sexual health, addressing sexual health, because whether oftentimes there can be sexual trauma, right? What are the reasons why we're sexually acting out? What are the behaviors include, right? Is it looking at pornography? Is it straying from your relationship? Is it frowned upon that you stray from your relationship, right? Relationships look very, very different today than they used to. So when you say, sexual addiction, depends. I mean, it's pretty broad terminology, but I think that, certainly being educated, and making sure everything is, um, there are no secrets, obviously consent, but just being open and honest about what it is you're doing. If some people want to look at, illicit images, and the person who they're with enjoys that too, well, then it's really not a problem, right? Becomes a problem when you start to maybe, is it affecting the four L's, right? Are you doing it? Are you acting out at work? Are you having problems in your relationships? It's costing you money. Are you getting arrested for things, right? Like, so, but yeah, definitely it's something to look further into, and there are some really good assessment tools, to self-administer.
And if someone was seeking support with sexual addiction versus substance abuse, would they look, do you need to find someone who's specifically in that area, or is it typically that everyone does everything?
No, there are people. There's a CSAT, or certified sex addiction therapist. A CSAT specializes in, sexual health. There are a couple in the city who I know and really trust. Addiction is addiction, true, but I would want, my people I work with to see a CSAT if they're able to. Sometimes that could be virtual, sometimes it could be in person, but I would certainly want them to see, a specialist, just like, the cancer, you know, maybe you go to somebody who's just all about cancer. Maybe you go to a specialist you know, for stomach cancer, so I believe in getting the specialized care that you deserve.
Excellent. Thank you, Andrew. And now I'm going to pass it over to Mark, who wants to ask his question. Mark, welcome, and you can unmute and go away. Go for it.
Andrew, first of all, thank you for your informative talk. This is my question. I was clearly an alcoholic on and off for decades at night and at social events. A codependency with depression. And then after a trip overseas with my wife, where I drank a lot in the evenings and also on flights, when we landed at O'Hare in 2017, I decided to go cold turkey. So this is my question. I had no withdrawal symptoms. I didn't seek any therapy or counseling. I didn't go to Alcoholics Anonymous, and I haven't had a drink since that date. My question is, how could I do that without any assistance and not go through withdrawal and continue not to drink over what is now 7 years? It's an absolute mystery to me.
Well, I mean, have you ruled out the fact that you might be a superhero?
Thank you.
Sorry, it was your backdrop and everything. If when drinking every day, it's different for everybody, right? Some people do have more withdrawal after 3 days of drinking. Some people, can go, weeks without. I think it's contingent on everybody, and they're different. As far as support, if like any other chronic disease, if my cancer doctor said, "Hey, listen, we think that you should get radiation," I say, "Okay." And if he says, "If you want to make sure that it doesn't come back and you want the best possible chances, you need to stay out of the sun," and gives me a list of more things that I can be doing for prevention, then I might take that into consideration too. I look at your relationship, and I'm not, suggesting, that you are not a superhero. But you might, are things going the way you want them to be? Could you benefit from talking to somebody? That's, maybe, but I think having a community, having support, having, other things to be a part of, the more things we can be a part of, the better we feel about ourselves, whether it be a religion or ethnicity or anything else, Cubs fan, White Sox fan, maybe it's Cubs fan. We like to be part of something that's bigger than us, right? Like the superhero alliance. You automatically feel closer to somebody, so or that's holding a Starbucks cup, we like to be part of something that's bigger than us. So feeling that sense of community can really fill that hole.
Andrew, I have a quick follow-up. In addition, I have had no cravings since I decided to go cold turkey. I used to go like to the Joel, which has a liquor section, and my hard liquor of choice was vodka. And I would always be drawn to the liquor section, and I'd buy big bottle of vodka. But now, I mean, ever since I decided to go cold turkey, I'm not a dry drunk. I don't ever feel the need for drinking. And if I go through the liquor aisle on the way to the hospital pharmacy and see all the gleaming models, it's just a blur. I just have no interest in stopping and kind of drooling over the possibility of drinking. So that's another thing I can't explain.
Yeah, I don't know. Again, let's not rule out your powers. You can be a unicorn. I mean, again, this is just, for most people, they have better chances if they do have, some sport, cravings. I've bent over and I burnt my arm. I didn't necessarily crave the idea to do it again. Sometimes we do things that are painful and we don't want to do them again. Or we've had, consequences in our, in our relationships. They say, if you drink again, you can, but you choose, you're going to be either hanging out with Tito or me, right? Johnny Walker or me. So, when we have those ultimatums and we realize that, it's our spouse or drinks, sometimes, it's real easy to say, you know what, my spouse matters more. So it's, you know, case by case. You know, I think it's fascinating. If you know, I'd love to, you know, investigate further and find out, you know, I love knowing why people do and don't do the things that they do. So you know, if you want to reach out to me, I'm happy to, you know, continue the conversation.
Thank you so much, Andrew. This was a wonderful presentation. We appreciate everyone joining us today. We will be sending out a thank you note for attending and a copy of the recording that will be on our YouTube channel. I put in the chat a link to a short survey. It just makes sure that we're hitting the mark and providing programming that is meaningful and also helps us to report back to various funders. So we'd appreciate if you could take a moment and fill that out. Upcoming events, our next Feed Your Mind is coming up quick. It is on October 10th, and it is the gut-mind connection, how nutrition can help with anxiety and depression. It's on October 10th at 12 p.m. Central Time, and this workshop is being facilitated by Meg Bowman of the Nutrition Hive. We're really excited about that. And please stay in touch. We have our annual event. If anyone is interested in coming and supporting No Shame on You on October 30th, a Wednesday evening here in the Skokie area. And you can go to www.noshameonyou.org, and right on the front page you'll see information about that meaningful program. It is called The Power of Storytelling, and you can get the details of our keynote speaker and more there. And with that, we will see you soon, and thanks everybody. Have a great day.